Hello and welcome to my second video for ANSI 345, Animal Health Management. I'm going to be discussing diagnosing and treating mastitis in dairy cattle. So to start off, we need to learn what mastitis is. Mastitis is defined as an inflammation of the mammary gland caused from trauma or an infection, leading to abnormal and decreased milk production. So abnormal milk could be thinner than usual, it could be off-colored, it could be blunt-tinged, or it could be kind of chunky and look like cottage cheese. So there's two types of mastitis, subclinical and clinical. So we're first going to discuss subclinical as it's usually a milder case of mastitis. So because it's subclinical, it presents without clinical signs, so it's often considered asymptomatic. And subclinical mastitis is an infection without apparent signs of inflammation or systemic involvement. So the infection is localized just to the mammary gland. The affected cow may exhibit periods of abnormal milk, and subclinical mastitis is best identified by testing for somatic cell counts. And this picture here on the left is showing a California mastitis test, which tests for elevated somatic cell counts. And subclinical mastitis also typically causes a decrease in milk production. There are a variety of different causes for subclinical mastitis, and this is not an exhaustive list or discussion, but most often it's caused by some form of contagious pathogen. So here on the left, we have S. agalactiae and A. aureus, or other gram-positive cocci. We also have staphylococci and streptococci. Those most often affect primiparous heifers, so heifers or cows that have had just their first calf. And heifers are even susceptible to it before they calve and begin milk production, and that could be fly strike or other things like that. Finally, we have mycoplasma or M. bovis, and this is prevalent in both clinical and subclinical cases, and it can be attributed to an increasing frequency due to herd fluidity, so cows that are moving from one farm to the next or cows that are being bought and sold can transmit this to other cows. Diagnosis of subclinical mastitis is most often done with a California mastitis test. So there's an illustration of the whole kit up on the left and then a picture of a sample here on the right. So to conduct a California mastitis test, a milk sample from each quarter is collected into a corresponding well, and it's important to remember which well you put which quarter into. You mix the milk with an equal amount of reagent. They recommend about half a teaspoon of milk and half a teaspoon of reagent. Normal milk will remain liquid and very fluid, and abnormal milk forms a gel, and the severity of the subclinical case is determined by the mass of gel and type of gel that you have. So if we look at this picture here on the right, we can see that the top left and bottom right samples have remained liquid and pretty fluid, and we have instances of abnormal milk here in the top right and the bottom left. So when you're swirling this around, sometimes the gel is so thick that it just falls right out of the well, and then you know for sure that you have a case of subclinical mastitis, which is an elevated somatic cell count. So treatment of subclinical mastitis can be done several ways, and here are two of the ways that I'm going to discuss here. So first of all, you could administer medication. All four quarters are treated with an intramammary infusion to eliminate pathogens and prevent cross-infection. So you want to make sure that even if you're just injecting into a normal quarter, that you get a clean dose of medication. Intramammary injections with amoxicillin, penicillin, or cephalosporin are preferred in cases where the pathogen is S. agalactiae. And systemic administration of oxytetracycline may also prove effective. However, it's important to remember that subclinical mastitis presents without systemic infection. Another way of managing and treating subclinical mastitis is to dry off the infected quarters. So that's ceasing milking of the infected quarters, and eventually milk production in those quarters will stop. This eliminates the infection by causing fibrosis of the infected quarter, and it avoids the need for culling from the herd, especially if you have cows who are genetically superior or you have cows that are yet to calve. This is a palliative approach to control because it doesn't really treat the infection, it just kind of eliminates the need to deal with it. And it could result in permanent loss of quarters. So if you have a really bad infection in that quarter and you stop milking it, that pathogen never really goes away. Moving on to a discussion about clinical mastitis. Since this is a clinical infection, you are going to see signs elsewhere in the body as well. So one of the visual symptoms that can be pretty obvious on the udder is an inflamed udder, and you're seeing that in the picture in the top right here. So clinical mastitis is an inflammatory response to infection. Presence of only local signs is considered mild to moderate, so this red udder would probably be a mild or moderate case of clinical mastitis, and systemic infection involving fever, anorexia, and shock is regarded as severe. Clinical mastitis typically affects only one quarter, and that affective quarter in severe cases will have serous secretions. So if you see this image here on the left, we have normal milk on the far left, and it's going through stages of a mastitis infection and stages of severity. So on the left would be normal, could be subclinical mastitis, but you're not going to really see that with just this file, all the way to those serous secretions on the right, and you can tell that that's a pretty severe case of clinical mastitis. The causes of clinical mastitis are similar to subclinical mastitis. The biggest difference is that the host defenses can no longer suppress the inflammatory response, and that's when the clinical signs appear. So the causes of clinical mastitis can be the same as subclinical mastitis. They're just more extreme and exaggerated. So again, we discussed a mycoplasma outbreak present in herds with high fluidity that are moving back and forth between farms, and also environmental pathogens, which could be present in the bedding, like wet or dirty bedding, and is also transmitted in the parlor by gloves or teat dip, etc. It's important when you're handling cases of mastitis that you have a separate teat dip for that, or you clean it out in between cows with mastitis to cows that don't have it to prevent cross-contamination. Clinical mastitis is best diagnosed with a bacterial culture. So milk from suspected cows is collected and then cultured for bacteria. Around 30 to 40% of clinical mastitis cases grow organisms on culture. So not every case of clinical mastitis is going to show bacterial growth. And about 90 to 95% of non-yielding samples do have streptococci and staphylococci, or coliforms. So even if it doesn't show up on the plate, that doesn't mean that there's not a bacterial infection present. Let's discuss how clinical mastitis is treated. So I'm going to be going through two different options here. The first has in common with a subclinical mastitis infection, and that would be an intramammary infusion. So all four quarters, again, are going to be treated with the intramammary infusion to eliminate pathogens and prevent cross-infection. This is the first treatment avenue recommended for cows with mild mastitis in a single quarter. Again, intramammary infusions with amoxicillin, penicillin, or cephalosporin are preferred in cases of S. agalactiae. Since clinical mastitis is often regarded as a systemic infection, systemic antibiotics are indicated for use here. So these should be used when one or more quarter is affected, udder changes are noted, or when the cow is obviously ill. Recommended medications are penicillin and erythromycin. In cases of E. coli mastitis, use of fluoroquinolones and cephalosporins are indicated. Prevention is the best medicine, and there are various ways to prevent instances of mastitis. One of the most important ones is reducing microbial exposure to teats. So this is more of a management practice and involves keeping clean housing and providing a standing period after milking to allow the teat canal to close. So after milking, the teat canal, or where the milk will exit, is going to be open for around 30 minutes. So lots of producers opt to feed their cows after milking, so they are obligated to stand and eat and allow the teat canals to close before they go and relax in their loafing areas that could have pathogens in the bedding or elsewhere. Also, milking hygiene is incredibly important. Teats should be clean and dry before the unit is attached, and germicidal teat dips are recommended to kind of eliminate bacteria on the teat. There is an immunization protocol for mastitis prevention, but the results are variable at best. It works most effectively in an identified risk group of animals, so cows, depending on their lactation stage or their herd risk factors, identifying cattle that are most at risk provides the most benefit from immunization. Immunization will reduce the severity of clinical signs but will not prevent the infection itself. So even if you're immunizing at-risk group cows, it's important to continue to monitor them for mastitis. So with that, these are the citations that I used, and I thank you for tuning in to my talk on identifying and treating mastitis in dairy cattle.